Welcome. My name is Michelle Ross. I am a Mount Mercy University student, currently in the Healthcare Law, Regulations, and Compliance course. This presentation is regarding waiting room confidentiality. Objectives. In this presentation, I will review the case study from the Department of Health and Human Services, review the research gathered to create a policy, outline the policy we plan to implement, and reflect on the policy, the strengths, and barriers that may come along with it. Private practice implements safeguards for waiting rooms. This case study highlighted a breach in personal health information, otherwise known as PHI, being disclosed to others. The specific scenario occurred when a staff member in a private practice gave HIV testing results to a patient in a waiting room. Several other individuals in the room heard the results. This case study stood out as it seems that this type of PHI breach, especially with the sensitive nature of the test, would not be occurring in today's healthcare landscape. The second portion of the case study was that of PHI that was viewable in the waiting room to others, specifically computer screens showing patient information that could be seen by others in the room. These two issues with confidentiality will be addressed in a new policy for this medical practice. When considering patient confidentiality, standards and regulations are built around the Health Information Portability and Accountability Act, otherwise known as HIPAA. HIPAA is a regulated act by the Department of Health and Human Services and is a federally adopted national standard to patient privacy. Within the professional realm, there are three main rules that must be followed. Privacy, which is an individual's PHI must be properly protected but also accessible to ensure high-quality care is given. Security. In today's landscape, this is even more of a pressing concern with the growing number of hacking instances occurring. This rule states that entities must ensure our electronic health information is secure and safe. This includes how we send communication and also how our information is stored. Lastly, breach of privacy. This rule states that any breach of privacy must be reported and gives definitions for a breach. In our example, the patient's PHI was breached due to being disclosed to others in the room without permission. Environment of care is the second portion of our case study that needed examined further. The physical space of a waiting room must be conducive to protection of patients' PHI. John and others studied 13 waiting areas. They found that there were dozens of breaches, some initiated by staff and some by patients responding to staff questions. Other breaches were computers visible to some in the waiting room that showed PHI, as well as phones at the desks where conversations could easily be heard by those in the waiting area. They even observed one situation where a patient was visibly concerned about sharing information being asked in front of others, but the staff member did not pick up on that and continued to press them for answers. All of these areas need to be considered when building or revamping space to ensure privacy. Step 1 of the policy states that personal health information of a sensitive or critical nature will be discussed in a private consultation room or private exam room. Prior conversations should be had as to how the patient would like to receive their results, rather through phone calls, letters, or face-to-face. Make sure that we offer that they can bring a support person to receive the results, and that we appropriately document patient communication requests. When patients have sensitive test orders, the staff will ensure they are aware of this policy so they can be prepared when coming back for results. This information will need to be documented at the time of the test and kept in the patient's electronic medical record. The second step of the policy is to ensure the physical space is constructed to allow patient privacy. Options may be soundproofing glass or windows being installed. A private consultation area may be appropriate if a new patient is arriving who needs to provide all of their PHI and demographics. There should also be a physical barrier between the check-in area and those in the waiting room. Online check-in can be used to reduce the PHI needing to be shared at check-in. Computers should not be visible to those checking in or waiting. Signage also needs to be visible for other guests waiting on where to stand and to give patients more privacy when checking in. Ensuring the physical space is conducive for sharing PHI is necessary for an added layer of protection and comfort to patients entering the waiting room. Strengths of this policy include improved confidentiality, reduction of privacy breaches, and improved patient satisfaction and comfort. Some barriers are that of staffing support. Providing dedicated time and resources to patients can be difficult when many healthcare agencies are facing staffing shortages, but taking time to ensure patients have support and time to ask questions is key in providing their care. Financial support is also needed, and another area that could be a barrier. To employ enough staff to ensure we can meet the care needs is one piece, but also purchasing and building costs to ensure the environments are set up for success is another big task. For this policy development, a team of professionals work together. This includes administration, nursing staff, providers, front desk staff, and case management. All of these need to be involved in policy development. But having the nursing staff, providers, front desk, and case management are very vital, as they are the ones having the conversations and doing the work. They will often have the best insight into the correct way to improve our care. Oversight of this policy will need to include close monitoring and follow-up. This may include monthly audits, and it will include implementation team check-ins on a regular basis. The policy should be reviewed as needed, but also in detail every other year. Thank you, and please feel free to email me with any questions.